My name is Aaron Levo. I'm the Vice President of Communications and Public Affairs. Welcome to all joining us today on Thursday, January 21st for our HHS virtual town hall. We have a crisp agenda today on topics related to our pandemic response. We'll also have the opportunity for questions at the end of the webinar, as well as a chance for celebrations. To kick us off, I'm going to invite our President and CEO, Rob McIsaac, to talk a bit about what we're going to hear on today. So Rob, over to you.
Thanks very much, Aaron. And hello, everybody, and thanks for joining today's town hall event. We're now holding these sessions weekly, at least for the time being, because the pace of information being generated concerning the pandemic is escalating. So we would like to do our best to keep you informed of the latest news around the pandemic and associated matters. So the items on our agenda today include an update about our pandemic response planning from Sharon Pearson. As always, Dr. Mertz will provide the latest on the epidemiology of the virus in our community, in the province, and in the country. Les Gauthier will touch on our ongoing vaccine distribution planning and execution. And as always, there'll be some time for Q&A and a bit of time at the end for celebrations. Over the last couple of weeks, we've had to be really nimble in our response to vaccine planning and distribution. It honestly feels like every 24 hours we're getting revised instructions from the province on how to manage this file. We got news just last Sunday about a slowdown in Pfizer shipments. And while that news was difficult to receive, we continue to be hopeful that the vaccine will be available to all HHS staff and physicians by the end of March. We will share updates as we receive them. And as I mentioned, Les Gauthier will be speaking to this. I probably have to warn you in advance, we just don't have all the information that we'd like to have to be able to answer every question, but we will do our best. In the meantime, if you haven't yet registered to receive the vaccine, please go to the HHS website and sign up. And you'll need to review the sequencing guidelines prior to finishing that process. As always, I'll convey my sincerest thanks to all of you for all that you're doing to care for our patients and each other. We've got lots to be proud of in terms of how we are serving our community and our province. In particular this week, I want to acknowledge everyone who played a role in helping Grace Villa to end its outbreak status. This is a very significant achievement from my perspective, and I can't say enough good things about the whole team who went into that most difficult situation and has been able to manage out of it to the point where we are today. I would say that although the pandemic, its future course is not entirely clear, I am confident that our internal planning, our ongoing collaboration with our regional and provincial partners will ensure that we will continue to be prepared to address this challenge. You may have recently become aware of media reports that the Ontario Critical Care COVID-19 Command Center is working to shift patients across the system as needed to avoid overburdening any individual hospital. We are starting to see those patients come to HNHB and more particularly to HHS. I expect that HHS will continue to be asked to accept patients who need our care over the coming weeks because of the epidemiology that we are seeing in Toronto and in West Toronto, West GTA in particular. This is all in an effort to ensure that every patient who requires critical care has access to it. Although I think, again, depending on the course of the pandemic, we may also start to see acute care patients being transferred across the region. So having said all of that, I'm going to turn it over to Sharon Pearson for more about how we're working with our partners to support access to COVID care. So Sharon, over to you.
Great. Good morning, everyone, and thank you, Rob. And off the top, I'll just amend that first bullet on my slide in terms of the record number of COVID patients. We actually have been higher at 98 patients, and today we have 87 COVID patients in our hospital. We know that's a somewhat fluid number, though, but it is nice to see a lower number. Every day we think about how we can best structure our sites and our units to manage the current demand and prepare for any potential future demand. And one of the decisions last week is we did designate JH as a COVID positive site. And really what that meant is we were always caring for the outbreak patients at the JH, as well as caring for the patients in the ICU. But what it does mean as a COVID site is that when a patient arrives in ED that's COVID positive, we will not transfer that patient out. And the second thing it means is that we could accept patients from other hospitals as well. So JH and the Hamilton General are the COVID positive sites, along with McMaster, who will manage their COVID positive women's health and pediatric population. Every day, because of the stresses on our capacity, we do think about our scheduled care, obviously, and every effort's made not to impact the care. We continue to manage about 83% of our pre-COVID scheduled care volumes. And in part, the reason we cannot get to 100% are the pressures from the COVID and related to the subsequent outbreaks that we have. And we do have, as you can see on the screen, just like all of our peer hospitals, unfortunately, a number of outbreaks that we're currently managing, and some good news in that we know some of those should hopefully come out of that outbreak status soon. And again, as every week, I would direct you to the hub for the most current information on each of those outbreaks. If we could go to the next slide. In terms of the planning and what's informing our planning, the ministry directive in terms of ensuring we have that 15% capacity available remains in place. And for HHS, that's about 150 beds. And from the numbers, we know we're over in half of that capacity now. And we continue to look ahead as how we create new capacity on an ongoing basis. As Rob mentioned, this load census leveling that's happening across the province, HHS is participating in that. As part of the region and as part of the provincial planning. We spent considerable time this week looking at how we can expand our critical care capacity, and we have formalized some new capacity at both the sites in order to respond to those needs, as Rob indicated, are coming primarily from the West GTA region. So that work will continue to evolve as we continue to daily get updates on what the modeling is showing us as far as critical care capacity. And then, of course, we are always looking at the ward capacity and what the implications are as we stretch beyond the footprint of our critical care areas. And very good news, as mentioned, about the Grace Villa outbreak, and that not all, but the majority of staff have returned to hospital. So again, thanks to all the staff that were involved in managing that outbreak and working at Grace Villa. We still will remain as the management oversight for Grace Villa in partnership with the operator of the villa and the ministry for a period of time until we know the home is stabilized. The other comment I would make around the outbreaks, well, it's very good news about Grace Villa. We have 19 other outbreaks within the city of Hamilton right now, and we know that some of these outbreaks can rapidly spread. So we don't know when we'll be called upon next to help in another home, and we're working on efforts to ensure we're prepared again. We continue to reach out to those homes in the most proactively we can in order to mitigate any risk that their outbreaks would spread, and we can help stabilize them any way we can. So that's my update for this week. And again, happy to take questions later on in the session, and I'll hand it back, I think, to Aaron.
Thanks very much, Sharon. Next, I believe we have Dr. Dominic Mertz with us today, our Medical Director of Infection Prevention and Control, as always, to give us an update on the view of the pandemic across the country and locally. So Dominic, please, over to you.
Yeah, thanks, Aaron. You're probably well familiar now with the figures that I'm using, and I sort of try to stick to those because of the familiarity with them. So again, here you see a map of Canada, obviously, with the number of cases per 100,000 per week in those black circles. And in addition, in the arrows, the estimated RT, and again, RT below 1 means that your overall trajectory is going to lower cases, so an average case infects less than one other person. And you can see a lot of green arrows there. So other than at this point, New Brunswick and Manitoba, all provinces tend towards lower numbers. When you're looking at the actual numbers in terms of 100,000 per week, as predicted last week, Saskatchewan now became the province with the highest numbers. Quebec now second with 155. And then we have Ontario with 139. New Brunswick, as mentioned, was sitting at 20 last week, now at 24. That's comparable to where most of the other provinces outside of the eastern bubble were sitting over summer and early fall. Next slide. That's the epi curve for Ontario. You see the blue arrow again that you are familiar with now, which was the holidays, where we saw that almost a dip because most likely people didn't go out for getting tested, and then sort of the post-holiday peak that we unfortunately have predicted is going to happen. And but since you would see we had a peak early January, and since the numbers are coming down, again, a reminder that those gray bars at the very right-hand side aren't definite yet. There will be cases added, but certainly heading into the right direction from a provincial perspective at this point of time. Next slide. In terms of hospital admissions, for the first time, we seem to have some flattening happened there, but the week is still young, so this may change, but it looks like at least no further increase in total numbers of hospital admissions in the province compared to the previous week. As previously said, certainly higher than the numbers we have had during the first wave. And you can see also an increase. I added a black line at the bottom to sort of highlight the ICU admissions there for patients with COVID, still higher as during wave 1 as well. Next slide. Now Hamilton, quite similar picture to what you saw previously with Ontario, maybe even a better picture when you're looking at what's happening over the last 5-6 days. I think we only had one day with more than 100 cases. So we seem to get consistently below that 100 mark now. I believe today it was another something in the 60s that have been reported. So we are pretty much back to where we had been prior to the holidays or early December at this point of time, which is certainly good news. Are we entirely out of the wood? Obviously not, but certainly trending in the right direction. Also, our positivity is coming down. All the markers are moving into the right direction at this point of time. Next slide. In terms of hospital admissions, and again, I mentioned it earlier that hospital admissions are lacking behind. So from a reduction in number of cases, it will take at least 1 to 2 weeks until you may see a reduction in hospital admissions as well. So we are pretty much at the same level as we've been the week prior. And I think that's more significant here in Hamilton than across the province, a very significantly higher ICU admission numbers than we've ever seen during wave 1. And this continues to increase, as you can see with in those like red, dark red columns built into the larger red ones. Next slide. I've shown you this last week, the predictions that the province came up with plausible scenarios ranging from a 0% to 7% increase. And I just added the line how it really looks like on the next slide, where you can see that reduction in number of cases at the provincial level outlined. So we are certainly outperforming even the best scenario that the province came up with last week. Again, good news, and I stop here and hand it over back to Aaron. Thank you.
Thanks, Dominic. Always good to end on good news. Appreciate that. Next, I'm going to ask our Vice President of Clinical Support Services and Surgery, Leslie Gauthier, to give us an update around the effort for our vaccine clinic. And I guess, as Rob alluded to at the outset, Les, we're beset by supply issues, and that's certainly characterizing what happens next. I know you'll address that a little bit today. So over to you.
So thank you, Aaron. And I should begin to thank Rob, because Rob has helped to reinforce the message that although we had a very solid plan dependent upon our supply chain, people have heard in the media that Pfizer is unable to meet the deliveries that were planned for Canada. So as a result of that, the province has given all hospitals in the province the direction, and I say hospitals and or public health units, that we were to stop administering first doses to anyone other than residents in long-term care and the high-risk retirement homes. And that direction was officially given to people as of yesterday. At HHS, we recognized that we were really in challenge from supply over the weekend, and people saw as of Monday a planned reduction of our first doses, and a number of individuals at HHS had their first dose appointments canceled at the start of the week. So we're all together and being super disappointed by it. I need to reassure everyone that vaccines are a provincial resource. They don't belong to an organization or to one public health department. And I know Rob and Bruce Squires, who is working with public health, are doing a very good job of escalating provincially on behalf of both the Hamilton community and HHS. So we are really trying to work with the province. We do not have a confirmed plan from the province on next steps, but we anticipate in the days to come, there will be lots more that will come out in the media as well. So we are continuing right now to administer second doses of vaccinations as they have been scheduled. Again, as I stated, this also could be subject to change. It's a provincial resource, and we'll take direction as we're being given. If I can have the next slide, please. So really important messages that I think everyone needs to be mindful of. The delay is temporary. This is due to Pfizer doing some renovation expansion work at their big factory. And what has been shared with us, it was anticipated to be over about 4 weeks. So we are anticipating resumption of the distribution of the Pfizer vaccine somewhere into mid-February into March. As soon as we know the plan, we commit that we'll bring the plan back out to everyone on the team. As Rob has encouraged, the actual tool to sign up and put your name into the randomization for the vaccines is still open. We did share via the hub on Friday of last week a revised sequencing framework. There was some specific ask of teams that we have clarified on the framework. So the tool is there for you to reference, and the same tool's been updated when you go on the tool to sign up. So it is important for us that people do sign up so we really understand the number of people who are sitting in each sequence and who we have left to complete vaccination for. So sincere apologies on behalf of the system that we're having to deliver this message and work through the pause. People have been absolutely awesome in terms of seeking clarification and working with us. So on behalf of the whole team, a big thank you for everyone's patience as we work with the province and try to get the updated vaccination plan out as soon as we can. I'm going to now hand it back over to Aaron. Now you can end with good news.
So we do have time for Q&A before we move to celebrations. Very tight agenda today. updating you on many of the issues that were part of the last town hall. Just really wanted to connect and make sure people had the opportunity to get the latest information. In terms of our questions today, we would ask that people please check the hub resources, which are updated daily, to see if maybe there is an answer to your question. Certainly you can still pose the question, and what we'll do is we'll direct you to those resources where it's appropriate. I know people have a lot of questions about the vaccine. We've been endeavoring to update the frequently asked questions document based on what we're receiving here in this forum and other places like the HHS News inbox. So check there for information, but feel free to raise a question. And if it's not part of the FAQ, we'll try and answer it today or put an answer up there between now and the next virtual town hall. So in terms of process for questions, what you can do is you can raise your hand in the participants forum and ask your question live. I see Phil M has his hand up already. As well, you can pose the question in the Q&A portion of our functionality there at the bottom. You just write in the Q&A section and we'll do our best to get you an answer. We prefer to leave the chat forum for our celebrations, but recognize that sometimes you use that as well for your questions. And we'll try and get through all of the questions over the next little while. I see, Phil M has put his hand down. So perhaps sometimes people hit that in error, but boy, oh boy, would love to have someone ask a question live. So please feel free to do that. Certainly there is a question asked about sequencing phase 1 and phase 2 for the vaccine. Leslie, I know that information is available on the hub, but maybe you wanted to add a little color commentary to where we got in terms of the phase 1 sequencing until this recent supply issue occurred and what we're thinking now about phase 2 and the start of that.
Right. So we actually reached a point over the weekend where, so how the tool works is it randomizes to phase 1, and then at a point in time where we need phase 2 into the tool, it starts to draw from both 1 and 2. So we actually did reach a point in the weekend where we were able to open up the sequencing to people who were registered into 2. There were still people from phase 1, sequence 1, who had yet to been vaccinated, but there were issues of phone calls placed, not answered. So if you don't answer, you stay in the tool as a phase 1. It's not a fixed list. So any day somebody else signs up for sequence 1, it kind of resets itself, and I'm talking with my hands. So yes, it's very probable someone from sequence 2 could have been called, dependent on which of the people placing the phone calls were working off of each list. So I think that's the question as to why did some people from sequence 2 get vaccinated before 1s? It was, we were at a point on the weekend where we needed to fill the clinics to open up to sequence 2. And that's the work we started. We then had to course correct late Sunday.
And in terms of, I guess there's a question here too that was asked about then, like, it's very difficult to project out where we'll end up in terms of completing sequence group 1 and beginning sequence group 2. Totally supply dependent, I guess, but is that an accurate assumption?
Correct. So we were well on track to the plan to be completed, those people who had submitted into sequence 1 by the start of this week. The other thing to remember is the province gave us different direction a week ago that our learners had to be included in sequence 1 if they were doing clinical on sequence 1 units. So the denominator of who's in any bucket continued to change as we looked at the sequencing framework and made some changes. Those are the changes that I just shared, are posted on the hub. So I keep coming back, the denominator of people in any sequence is never going to be a fixed number. It's going to change as we get provincial direction or as the city table makes different decisions about who belongs in 1 and who belongs in 2.
Dave, I see you've popped up. Would you like to add a comment to that question or something additional?
Yeah, I guess I could just add, and thanks, Les, that was perfect. Just the notion that you know, the registration, the sequencing, all has been done very carefully, and it's all been very, very fluid, and all of it has been impacted, of course, by changing direction on occasion from the or pivoting from the province in terms of what the priorities are, but very much supply. So it's very difficult to project out when we'll be in a position to begin, heavily distributing first doses again. We will need to get more information from the province about supply, and we're waiting for that information ourselves. As soon as we know more, we're trying to be as both responsive to what happens in all the circumstance, but also as transparent as we can, as quickly as we can with everyone here.
Thanks.
Aaron, can I have another
Yeah, go
comment?
ahead.
And that's just because we are paused, we actually have very good opportunity to go back and cross-reference who's in sequence 1 to who we intended to be in sequence 1. So people may be reached out to say, the unit you work on really belongs in 3, not 1. So both St. Joe's and HHS have committed to kind of ensure we're confident of who's sitting in sequence 1 while we are paused. So there'll be a bit of happening on that over the next few weeks.
Great, thanks. There was a question in here, and I don't think you addressed it specifically, Les, but just the notion of Moderna versus Pfizer. Pfizer's slowed down, but is there any way to ramp Moderna up, or do we have supply? Is that supply part of the fan out that's occurring now?
So great question. I think Bruce is online.
I think Bruce had to join an IMS call. He's not with us now.
Oh, okay, sorry. So I'll answer that. So originally, as we started the work, Pfizer was the vaccine that was not mobile, and it was being used at the fixed clinic at 293 Wellington. Over recent weeks, there has been work done that Pfizer can be moved, and we did bring some of the Pfizer vaccine into long-term care, which are the system's highest priority patients and staff to vaccinate. The Moderna vaccine has now been the primary vaccine for long-term care and retirement home. But we do realize, and this is with the assumption that the allocation we have still belongs to the city, there are some populations that we may be able to go out and support with Moderna vaccine. Included in those populations are our own teams on sequence 1 who we've not gotten to yet. There's actually 4 groups of populations, and that work has gone to the city table. And we're looking at Rob to help with public health to advocate that the province gives us permission to use what's left of Moderna. It's going to need some work because it just needs different processes to give than a Pfizer vaccine. But again, we're waiting for provincial direction. Rob, I don't.
Yeah, maybe I can just supplement that. We have made a pitch to the province there is some Moderna vaccine left here in the city, although, the quantities are pretty finite. But what's been made clear by the province is their first priority is residents in long-term care and high-risk retirement homes. And so there's a very good chance that what Moderna we do have will be scooped by the province and reallocated elsewhere in Ontario in order to get needles into arms of residents in long-term care and high-risk retirement homes. So we're kind of in a holding pattern right now, waiting for the province. They are doing some additional analysis in terms of how much supply is left and how many critical populations are left to do. So we've been told to put everything on hold except for second doses.
Good. Just while we're still on the topic, and I think we've talked about it, there is a question here about, the provincial decisions for allocation, why some remote or virtual employees that are at low risk might have received the vaccine before some in the community. How does that balance being struck between HHS employees who are a priority for vaccination versus the broader community, even if perhaps somebody isn't really at a high risk in their role?
So do you want to start, Rob?
Well, I guess I'd say that work is primarily the bailiwick of public health. And so there is a sequencing committee set up at the city level, which is looking at the provincial sequencing mandates and, community healthcare workers are essentially in the same bucket as hospital healthcare workers. And so, that work is we do have a window into that work, and we do have an ability to ask hard questions, which we are doing. But ultimately, those decisions are made by public health.
And I guess, Aaron, my only other comment to add to Rob is we need to remember that Toronto and Ottawa actually got their vaccine allocations 2 to 3 weeks in advance of us, and they were further down their sequencing framework. So there are examples of where Toronto was actually in a position to offer vaccines to non-forward facing teams. So we absolutely know across the province, it's not been consistent in terms of time. So lots of people have raised lots of questions with us in the last few days. Again, it comes back to, it was the provincial rollout. It was not equitable to communities. It was not sequenced all at the same time.
Understood. I do see someone, Joan Urquhart, in our participants forum with a hand up. Joan, if you'd like to ask your question, you'll receive something asking you to unmute on your end now. If you could go ahead and do that, you can ask your question.
That was a mistake on my part.
Okay. Nonetheless, if you do come up with a question, Joan, we're here for you. I guess before we leave the subject of vaccine, Leslie, one question here about process in terms of confirming appointments, email versus a phone call. Some employees, specifically in the lab, can't have their phones with them. Is there a reason we've defaulted to phone, and is email an option at all?
So the way the current system is if you book your appointment and it's greater than 24 hours out, you will get an email and a text confirmation of that appointment. Because we were working so quickly, a lot of appointments were being made today for tomorrow and within the 24-hour window. So there was no mechanism that people could be emailed or text. For certain, your second appointment is going to be greater than 24 hours, so you will get the email or text confirmation. The process that was established in terms of scheduling is whatever phone number you entered into the tool, and you have a choice of only one number, that is the number by which you'll be contacted. I remind people, if you put in your mobile device, it does come across as a no caller ID, and there's not capacity to manage messaging. So if you aren't able to pick up your call, then they go to the next person in the sequence. So whoever has asked the question from the lab, I think it's worth taking the question back through your leadership team at the lab around, is there a process within your unit even that you could work out to manage your phones? There really right now is not another option. I will share, we are bringing a group together to look at the actual tool and how messaging happens to see if we can make any enhancements. So your feedback's really valuable, and I'll bring it back to that working group.
Thanks very much for that. There is a question here, maybe Sharon, you can offer some insight on this one about redeployment. I know we've had, as you mentioned, successful redeployments to long-term care homes and help to stabilize that situation. Certainly something we anticipate we might have to do again. We've redeployed staff internally. Just if someone's identified for redeployment, internal or external, will they be contacted prior to that, or how will they know?
Yeah, and absolutely, that would be the best case scenario, that we would want to be working with staff in advance of being redeployed. The directors are meeting with the leadership teams, and there are processes being put in place on the units to ensure we can proactively have the messaging out to staff so they understand what the process could look like. And I would just reinforce, we are really trying to get ahead of these crisis in the long-term care home, so we don't end up in these urgent situations of having to deploy staff at 5 o'clock at night. So even some advance notice would help us prepare staff. So every effort will be made. Thanks.
Thanks, Sharon. So I think we've managed a number of the questions today. I'm going to move us to celebrations. I just wanted to read out a great comment from Andrea Frolick about the subject of vaccine allocation, and just a reminder that some people who work in back office functions at the hospital might also be an essential caregiver to someone in a long-term care home and receive their vaccine for that reason. Really important to remember that people, aside from their professional job, have other aspects of their lives that might have qualified them for the vaccine and the sequencing that's been set out by public health. So great point, Andrea. So at this point, I think I'm gonna do the call out for celebrations. Rob, if you wanted to join me, reminder to everyone that's on today's webinar, you can raise your hand in the panelists or attendees list, and we'll call on you to read your celebration. You can type something into the chat forum, and that's another way for us to bring that to the broader audience. Rob or I'll read it out.
Yeah, Aaron, maybe I could just start by saying Lincoln Alexander Day is a national day of recognition held every January 21st to honor one of Hamilton's most historic and distinguished figures. The Hamiltonian, Link was the first Black member of Parliament, a cabinet minister. He was a lieutenant governor for us here in Ontario and a champion of equality and excellence his whole life before he died in 2012. I knew Link, and he was an extraordinary individual and really did a lot for our community. So I think a fitting celebration.
For sure. Thanks for that. Dave, I see you've come on camera. Is there something you'd like to bring to the group?
Yeah, I just wanted to call out the Integrated Decision Support Team, or IDS, as we have lovingly called them for many years. This was a brainchild of HHS that has provided cross-sector, really, analysis and information capabilities. It underlies a lot of our ability to look at a patient and their journey across sectors, emergency departments or home care, et cetera. And that is something that has now been essentially transferred to Ontario, the Ontario Hospital Association, the OHA. And the reason for that is a recognition of the importance of it and a recognition of the need to be able to scale it up and make it available to every organization, every hospital in Ontario. So it's a real kudos to the blood, sweat, and tears of the team that they got such amazing tools in place right here at Hamilton Health Sciences, and that it's now going to take the next step in its evolution and provide even more support and decision-making capabilities for the whole sector. So congratulations to the team as they move into that next phase of their journey.
Thanks for making that, Dave. That's great. Have one here from Yulia. I hope I said your name the right way. To the HHS team deployed at Grace Villa, amazing job. Absolutely. See one also here from Sheila Price. Continue to thank our point of entry screeners for all they're doing, screening every entrant to the hospital. Wonderful work. All right.
One here from Kim, Aaron, celebrating all the EHS staff who have been working around the clock, overseeing outbreaks, and staff affected by the pandemic. Thank you for all your hard work. Absolutely.
Good stuff. Well, we might have a shorter celebrations section today, Rob.
Yeah, I guess we can, maybe we'll call it a day. Thanks all for attending. And look, I know the news around the vaccine kind of feels like a punch in the stomach. It did to me anyway. It's sort of the most hopeful thing that we're working on, and to hear about these delays is difficult, but I think what can we do but hang in there. I am feeling pretty optimistic that this short-term delay will ultimately result in lots more vaccines, so that when we do get going again, I'm hoping we'll get going in a very big way. So thanks all for attending today, and I hope you have a great rest of the week.